We all know that being overweight is bad for you, but a new study has found that it matters a lot where you carry any extra kilos. Researchers have found that a persistent midriff bulge is linked to an increased risk of sudden and often fatal heart failure. With more, here's Professor Prof Huxley from the University of Queensland, who co-authored the study. So, Rachel, what can happen to people's hearts if they're large around the middle?
Well, one of the things that we found from this study was that having what we would describe as having excess body fat around the central part of a person's body predisposes an individual to having a sudden cardiac arrest, which is a significant problem in Australia. We estimate that between 22 to 33,000 sudden cardiac deaths occur each year in Australia alone, and unfortunately for about half of these events there is no warning signal until the event actually strikes, so it is a huge problem.
So this isn't a heart attack in that traditional sense, this is just the heart stopping?
Well, that's right. If you think about the heart as a pump, a heart attack is normally what we would define as a problem with the plumbing system. There's a blockage. Whereas for sudden cardiac death, there's more of an electrical malfunction. It prevents the heart from pumping efficiently, so blood, in essence, can't get pumped around the body.
And how big does your tummy bulge have to be in order to be at risk of this?
Well, that's a very good question. I think how we've defined it in the past, if you measure your waist and your hips, and then you divide the waist by the hip score, ideally we would want it to be around 0.7 for women and around 0.8 for men. But in reality, if we look in the Australian adult population, it's far higher. It's around 0.85, 0.95 for men. So we want to try and keep it as low as possible.
But in terms of shape, how does that look?
Well, if you think the ideal shape for women is the classic hourglass shape. If you think about the old-fashioned movie stars back in the 40s and 50s, they would have a waist-to-hip ratio of about 0.6, 0.65. Now, if we look in the general population, people are much more angular. There's no definition around the waist, and therefore they have a much higher waist-to-hip ratio, which predisposes not only to sudden cardiac death, which is a significant problem, but also things like type 2 diabetes.
BMI, body mass index, has always been used as a measure for being healthy. Is that not right now?
No, I wouldn't say that. But the body mass index is an incredibly useful risk predictor, and it's very easy to measure. You just need your weight and your height. Measuring an individual's waist and their hips is slightly more complicated, and particularly in obese individuals, it's very, very difficult to actually identify whereabouts is the waist and where the hips are. So it really should be used as a complement to BMI. So for those individuals who are particularly worried whether they might be at increased risk, it's always worth going to their health professionals and having it measured reliably.
And for many people, though, of course, that area around the tummy is the hardest area to shift the fat from.
That's absolutely right. Unfortunately, there is no magic bullet. There's no one single exercise that will specifically target a problem zone. When we lose weight through a combination of diet and exercise, we tend to lose fat all throughout the body. There's no specific area where there's a benefit in terms of particular exercise, unfortunately.
Prof Huxley, thank you.
Thank you.